Hello, and welcome to the Science on 7th live stream, a virtual space where we talk about issues related to air quality and health. I'm your host, Pallavi Pant, and I'm really excited today because in exactly a week, we are going to be kicking off the Africa Clean Air Forum in Pretoria, South Africa. I think we have a graphic that we can pull up. This will be the fourth edition of the forum. It's hosted by the Africa Clean Air Network. And as Health Effects Institute, we're really excited to be partnering with the network for this edition, as well as our partnership in previous editions. We're hoping that some of you will be joining us for the forum, where our theme this year is investments for clean air. And this is a topic that has been gaining a lot of traction in recent years. There is conversations around how can we finance clean air actions at the city level, at the national level. So today we thought it would be helpful to discuss exactly this issue. How do we finance for clean air actions and clean air interventions? And to tell us a little bit more about this topic and to walk us through work that has been happening in recent years, I'm really excited to be welcoming two very special guests. First, I'd like to welcome Daisy Lanvers, who's an health economics expert with UNDP's Global Prosperity and Wellbeing team. She leads health investment cases, including work on ambient air pollution that she will be talking about today. And her work has focused on environmental economics. So, Daisy, really glad you could join us. Thank you.
It's a pleasure to be here.
I'm also very excited, and I know Daisy and our next guest have also worked together on this topic together. So, really pleased to be welcoming Selina Amoa, who's the Acting Director for Environmental Quality at the Environmental Protection Authority in Ghana. She, of course, has also been working on this topic of air quality for several years and has led fantastic initiatives in Ghana looking at air quality improvements. So, welcome, Selina, as well. Really glad you could join us.
Thank you. It's a pleasure to be here.
Amazing. So I think I'm going to start with a really simple question. I know both of you are joining us from very different places. I'm in Boston right now. It's raining. The air is clean. It's a little cool this morning after a really horrible heat wave, I have to admit, over the last few days. So if I can maybe go first to you, Daisy, and then to you, Selena, just tell us a little bit about where you're joining us from and also what is the air quality where you are today?
So I'm joining from a small village in the French Alps called Morzine. The air quality index today is about 34 and PM 2.5 is around 6.2 micrograms per cubic meter. So the air quality is good. We've also just been through a horrific heat wave in France. So it's cooler now, which is nice. But we're about to have another one next week.
Selena, how is it for you? Can you hear us? I think we may have some connectivity issues with Selena. Do you hear us, Selena?
Selena, and I'm joining from Accra. The air quality index is around moderate at the moment at where I am.
Okay, great. So at least we are all in places where the air is relatively clean. But of course, we've had a lot of guests over the past few years who join us from places where air pollution levels can often be really high, or they're in the middle of an air pollution episode. And it is an issue that is gaining a lot of prominence or has gained a lot of prominence in recent years. So the obvious question that tends to come up is, this is an environmental concern, this is a public health concern. So why aren't we seeing the levels of investment that are necessary? Why is this not a priority? What are some of the barriers? And I know, Daisy, that your team has worked on a fantastic report recently. I think we can pull up the really wonderful graphic on there. But can you walk us through a little bit what some of the barriers are that have been identified and how they can hinder the progress towards clean air?
Yeah, of course. Thank you. So this is a study UNDP developed with the Clean Air Fund, and we basically looked at 15 low and middle income countries and conducted desk research, but also interviews with ministries of finance, with ministries of environment, ministries of economy and treasury, to really understand why isn't there more financing in air quality. And if we pull the graph back up, we can see that we found basically 9 key barriers through different typologies, and these are all interlinked and mutually reinforcing. But we can see that there are institutional barriers. So there's a lot of fragmentation, first of all, across mandates, across governments, and a lack of accountability, perhaps, or understanding on who is responsible for what when it comes to air quality. There's also this challenge of local versus national government capacity in terms of human resources, but technical capacity. Then there are planning and pipeline barriers. So point 3 here is that evidence is often not linked to investment decisions. So this is really about lack of data on the burden of ambient air pollution, or the sources emitting the most pollution. So that impedes investment decisions. Air quality policies might exist, but they're not often costed or financed. And air quality can be absent from sector investment programs. So these all impede the pipeline process, and that's why proposals stall at this stage. But there are also fiscal and financial system barriers. And what I personally found out during these interviews is that many countries don't have a specific budget line for air quality, while they would have it for transport, for energy, and therefore an investment decision can go into that budget line. But air quality is often embedded or hidden in another line, which makes it difficult to advocate for, to push forward. A seventh issue that's very close to my heart is that appraisal tools tend to undervalue air quality benefits. So here we tend to think of investment in air quality as a cost rather than an actual investment that can generate positive benefits on health, on productivity, on the environment, and therefore the costs are not represented next to the benefits. We only think of the cost when looking at air quality investments. And then last but not least, there are important barriers linked to regulations and political economy. So political commitment can be difficult to sustain, especially if the benefits of interventions will be felt after 4 or 5 years, which doesn't align with political cycles. And then finally, weak enforcement. So if polluters don't face credible obligation or enforcement, then that will impact the effectiveness of policies. So this is really just a summary of the study we did with the Clean Air Fund, but it gives a clear idea of the interconnectedness of these different barriers and how they need to be tackled together to improve investments in air quality.
Yeah, thank you for walking us through that. And I think one of the things that really struck me was also the fact that when we are talking about the investment barriers, it also connects to a lot of other gaps that might exist, especially on that evidence to policy spectrum, where you may have the right data, but it may not be accessible to the right people or to the right decision makers, or we may not be generating the right data sets to begin with. We may be generating things that we think are important, but are actually not helping us. And Selena, I'm curious, because you are a policymaker, and I'm sure that these are some of the challenges or barriers that you would have come across in your work. But this sort of constellation of different types of barriers, how do these resonate with your experience working on air quality in Ghana? And are there specific areas where you faced more challenges or more barriers compared to others in your context?
Okay, thank you very much. I think she has covered most of the barriers. It is general, if you look at what is happening in other countries, those are the general things that are happening. So it cuts across all the countries, and that includes Ghana. But I also want to mention specifically, when it comes to dedicating funds to invest in air quality issues, the environmental issues that are confronting us are many. And you have water pollution issues, you have sanitation issues. So when it comes to dedicating money for investment, you look at the issues that are present at the time when it is needed. And most of the time, because air quality, you don't really see it. Apart from particulates, when the levels go high, you could see the particulates level high. But when it comes to the gases, you don't really see with your eye. But the impacts are there. So sometimes we are tempted to overlook the investment that we have to make in terms of addressing air quality issues. And then the other thing I want to add is on attitudinal issues that because the things we're talking about has been with us for a long time, we tend to ignore the evidence that is coming out indicating that it's impacting on our health. Sometimes you ask people, you talk about air pollution to people and they think that, oh, this thing it's been with us for a long time. If it is about using biomass in cooking, our forefathers were using, nothing happened to them. If it is about vehicles, even those times the vehicles were more polluting and all that. Industry, the same thing. So it's like we've gotten used to the system as it is, and we don't see the need for us to take action to address some of those issues. So those are some of the few barriers that I want to add on to what she has said.
Yeah, thank you, Selena. I think you're also, highlighting sort of there's the technical, scientific, data-related barriers, but then there's also behavioral or perception-related barriers, which can, lead to these other conversations or decisions that may not necessarily result in more investment. But I think one idea that has been gaining ground is, can we build really compelling investment cases for cleaner action? As I mentioned earlier, this is also the theme for the Africa Clean Air Forum that's coming up next week. But this conversation has taken place in many different contexts. A few months ago, at the Better Air Quality Conference in Bangkok, which really focused on Asian air quality sort of discourse, similar conversations were being had around, if we have a really strong investment case, it can create more opportunities or it can help propel cleaner action. We also had a conversation with health experts about a month ago, where we were talking about the health case for cleaner action in Africa specifically, given that the population, majority of the population is very young, there's rapid urbanization, population is still growing. And I think one really good example is the investment case that has been recently completed for Ghana. So Daisy, I think working backwards from where you would have started this process, like what kinds of data were needed, what methods are employed to get to a point where you have a strong investment case for cleaner action.
Yeah, so we actually, that investment case was published just last week, so we've just finished it, and it was a project we developed with Breathe Cities from the Clean Air Fund, and working closely with stakeholders in Ghana, especially the EPA, but also Ghana Health Service, Ministry of Environment, academia, civil society. So it was really a collaborative process, and I think that's something that's very important when we do this kind of work. It has to be government-led and government-owned and bring together multi sectors. And so what we did was we started about just over a year and a half ago, and we first start by doing a burden analysis to really reveal the burden of air pollution, to showcase how many people die every year from ambient air pollution. What does that cost to the economy? How many cases of diseases are caused specifically by air pollution? And so we did this, and then we can show the results on the screen, actually. The results are really striking. What we see at the national level, so in Ghana, is that more than 12,800 people die every year from ambient air pollution alone. So this excludes household air pollution. And on top of that, more than 316,000 cases of diseases are caused by air pollution. These are ischemic heart disease, stroke, lung cancer, cardiovascular disease, diabetes. These are all caused by ambient air pollution alone. And in terms of economic costs, again, the results speak to themselves. Every year, ambient air pollution costs Ghana more than 1.9 billion US dollars. That's equivalent to 2.3% of the country's GDP. So the losses are huge, whether we're looking at health impacts or economic impacts. But what we did alongside this economic modelling, and it sort of touches on the point, Selena, you just mentioned, is that we looked at the behavioural aspect and the political economy aspect. So we carried out one-on-one interviews with various stakeholders from civil society, local government, national government, academia, UN agencies, and we really wanted to understand the work that's been going on, the barriers and opportunities to cleaner air, and really capture the different perspectives of stakeholders working on air pollution, whether directly or indirectly, to really understand how we can bring this effort of cleaner air together And so by combining that economic modeling with the institutional context analysis, the qualitative component, we developed an investment case that's really grounded in national realities, and the recommendations were drafted by national stakeholders based on their experience. And I think that was a really super interesting project, and I'm so pleased to have worked with Ghana on it.
Amazing. That does seem like a very involved process, and both in terms of engaging the variety of stakeholders that would be needed to come up with a case like this, but also the data that you would need in order to do the analysis. And as somebody who spends a lot of time looking at health data and air quality data and burden assessment, I'm really curious, like how easy or difficult it was to access the types of data that you would need for such an analysis. If we think about repeating this in other places, or even in the context of Ghana, what was that experience like?
So I think as an economist, I can never have too much data and I always want more. But we were very fortunate in Ghana to work so closely with local experts and stakeholders. So the EPA shared all their data on air pollution monitoring. Ghana Health Service shared the data on cost of treatment, Ministry of Finance on the macroeconomic data. So all the data we needed and that was available in Ghana was shared with us, which was fantastic because it means that the robustness of our results, it really depends on what we feed the model with. So that was great that we could secure the data that was available. Unfortunately, some data just didn't exist in Ghana when we're looking at the cost of specific interventions or the impact. In that case, we did have to rely on proxy data from other countries, which is a limitation, but it's also the reality of measuring effectiveness of air pollution mitigation interventions. And that's why it's one of the recommendations in our investment case, to strengthen and continue efforts to gather data, to continue monitoring, because data is extremely important for advocacy, but also to secure funding and financing for air quality investments. And then just on your last point on if a country did want to do a similar analysis, UNDP's actually published a methodology that describes all the data needed to carry out an investment case. So there's a lot of data on pollution, on health, on macroeconomics, and we have it all listed. And we also have the step-by-step guidance with the tools and the data collection sheet that really describes the assumptions, the data inputs, and the model so that anyone can run an investment case. And then that's published online as well, yeah.
Amazing. I think that, there's always that, balance of what data do we have access to and we can use to at least start our actions and interventions versus data that we really need to build more robust analyses. And I think I always tend to say we have data that is needed to take action, and then more data will help us refine those and get better at estimating and forecasting and modeling. Selena, I am interested to hear your perspective on this, both as somebody who was involved in the process of creating this investment case, but also as somebody who is spending their time and effort in thinking about how to make the best case for air quality interventions within Ghana. Do you see value in analyses like this to further the conversation or to move it more towards action?
Yeah, of course, yes. When we talk about making investments, it's all about the evidence. What evidence is there? And lack of evidence also limits action. So once we know this is what is happening, that alone should drive us to take action to address the issue. Like the study or the analysis revealed, if we know a number of people, over 12,000 people are dying every year as a result of air pollution, and look at the costs to GDP, and if there is a need for us to address the air pollution issue and reduce the number of mortalities and also the cases that we are recording, and also its impact on our GDP, I think it's a good thing. But it is the data or the evidence that will push action. So I see this as a very important step in our effort to fight air pollution or to promote clean air in the country. And again, in the past, there has been some analysis, there were some statistics. We have put in some interventions. How are we doing? So this is a fresh one that tells us, if we look at the statistics in the past and then what we have currently, are we making progress? Are we really making impact with the interventions we are putting in place? And that can also inform if there is a need for policy review. We look at what we have done, the existing policies, the evidence that is there, and that can also inform us whether there is a need for us to revise our policy or to introduce new ones or whatever decision that needs to be taken to address the issue. So I see this as a very important step in our quest to manage air pollution in the country.
Yeah, thank you. And actually, I'm really glad you brought up the idea of the interventions that we already put in place. Are they having an impact? Because this is such an important question. Whenever we are able to show that there were improvements as a result of interventions, either in terms of reducing exposure to air pollution or improvements in public health, I think that in itself becomes really compelling to then get to more action. And I think Ghana has really been at the forefront of a lot of air quality management, regulation, and decision making conversations. So hopefully, this experience from Ghana can also inform other countries in Africa, but also countries elsewhere that may be thinking about how to do this type of analysis and how to use it. So, in that vein, Daisy, are there efforts already underway or planned to do similar types of assessments in other countries? You mentioned that there is a toolkit available if people wanted to do it themselves. I think we'll have to publicize that, and also get more people to use it. So that's, I think, something for HEI and also for the Africa Cleaner Network to really pick up on. But are there similar efforts underway or other conversations around stronger, compelling investment cases for cleaner action?
So actually, we're currently developing a similar investment case in South Africa. So the slight difference is that we'll be focusing on 3 hotspot areas. So we'll be doing the national analysis, but also conducting separate analysis on the 3 most polluted areas in South Africa. And that will be really interesting because it will allow us to really provide localized economic modeling and to see perhaps how the morbidity or the emission sources differ across regions within a country, or how some interventions might be more suitable for one region or another. So I'm really looking forward to that work and doing this investment case. Again, it's with Breathe Cities, and we're hoping to finalize it this year. So stay tuned, and hopefully it'll be published by the end of the year.
That's wonderful to hear. I think also because in terms of the source mix, there is quite a difference between Ghana and South Africa. So hopefully what the investment case shows us will also be, that sort of distinction across sources, especially around energy generation and household use of solid fuel. So really looking forward to it. I think, Selena, from your point of view, again, as somebody who's engaged on this issue for a long time now, if other cities and other countries were thinking about doing similar analysis, what would be your advice or your suggestion to them, to your counterparts that may be sitting at other environmental protection agencies across Africa and also beyond Africa?
Okay, so when it comes to air quality management, it is not about one institution. Like we rightly said from the beginning, the sources cut across sectors. And it is important that if we want to really manage the issue, we bring people from the various sectors together. And like I said, evidence is key for whatever intervention we want to put in place. So if there is an assessment like this, I will encourage all stakeholders to provide the needed data that we need. It is about a country, it is not about individuals or about institutions. But once we get to know that this is what is happening across, like I said, it's coming from various sources. So the cumulative effect, then we can together think about how we can come together and address the issue. Ghana, we developed the air quality management plan that we're trying to implement for the Greater Accra region. and it's looking at bringing stakeholders from the different sectors so that together we consolidate efforts to address air pollution. So once you have this assessment and the evidence is there that this is how much it is costing us in terms of our health, in terms of the GDP, and then we put efforts together and then we try to implement certain interventions, we can go back. When there is a win, it is for all of us. It is not about individuals, like I said. So when you come to Ghana, we said environmental protection is a collective responsibility. It is not only about one person or one institution. So we should all team up. Together, I think we can make impact. But if we decide to work in silos, each institution or each sector working alone, we may not be able to achieve the impact that we desire. But when we come together and then we work together, I believe that we'll be able to move forward in our fight against air pollution.
Amazing. I think that's always such an important message that we need to cut through our silos and look at the problem in a more holistic way. I think as we start to come towards the close of our conversation today, I want to talk a personal question. You've both had very different professional trajectories, and you're both like women working in the spaces that you work in. So both from your professional experience and as women that are working on issues related to air pollution, people that may be interested, especially younger people, that we really need more young people in the field. What would be your suggestions or your advice to them as they consider their career options? Daisy, I'll come to you first and then go to Selena.
My advice would be go for it. Air pollution is such a fascinating topic. I think it's complex. I mean, technically speaking, it's probably more complex than other risk factors or investment cases I've done. But it's such a meaningful topic and we need more experts. And this is something I've heard when working with countries, but also with UNDP, we need more experts, and not just health economists, but also urban planners, climate experts, epidemiologists, policy specialists. And I think just like we were saying that government stakeholders need to work together, I think scientists and social scientists need to work together on air pollution because it is cross-cutting and we need to work together. So my advice would be go for it. It's such a meaningful topic and it's fascinating, and there's still a lot of work to be done.
Selena.
Right. I think it's a very interesting area. When it comes to air, everybody needs air. If it is water, you can decide to go for water from a particular source. But air is a common good. Everybody breathes the same air. And once it is polluted, it affects all of us. And like I said, it's a very interesting area. And like Daisy said, we need more experts on board. And you mentioned those who are interested. The interest is very key. Because if you want to solve a problem and the interest is not there, you start and then you see the problems confronting you and you want to retract. So once the interest is there, I will encourage them to pursue, just move forward. What makes it good is that in our modern times, there are already women who have made it. So they are there serving as role models. And then if there are people that you need encouragement from or to guide you, there are women there who can assist. So I want to encourage young women. And let me be a bit biased here. When it comes to things like this, women can do it and do it better. So let's go with all the boldness. We can make it. Others have made it. We can also contribute in helping to address the issue that is confronting all of us.
Indeed. Amen to that. I think my final question to both of you, again, I'll go to you first, Daisy, and then to Selena. We've acknowledged that there are still significant barriers, lots of data to be generated, lots of work still to be done. But we want to hold on to the hope that, this is an achievable dream, that we can get to clean air for everybody. And I'd love for you to share one thing that gives you hope about this, shared future and shared vision of clean air for all people.
So I'm a very hopeful person, so it's difficult to pick one, but I would say just hearing about local initiatives from NGOs or small groups and how they come up with innovative ways to raise awareness on air pollution or tackle air quality, and hearing success stories, whether they're big or small wins, that's so inspiring, and that would be my one pick.
Selena?
Well, I want to agree with her what she just said. You know, the what gives me hope is that you see a lot of advocates now coming in and then talking about air pollution and then the need for us to address. So it means that awareness is being created and we are getting aware that we have an issue that we need to address. And things like an assessment that was done, also giving us evidence. And once it is there, it drives action. So that gives hope that, with all this, we'll be able to get somewhere.
Fantastic. Thank you very much, both of you. I think what I'm going to take away from this conversation is that, yes, there are still significant barriers when it comes to financing clean air actions and interventions, but there's stronger momentum, more data, more resources available to scale up the types of analysis that are needed. And also that, this is an issue that can be solved through multiple actions at multiple scales through collaboration. I think that's a really powerful message to constantly be reminding ourselves of. Thank you for your time today. And also thank you for all of the work that you continue to do to get us to that future of clean air. Selena, I'm really excited to see you in Pretoria in a few days' time. So safe travels. And Daisy, hopefully we will continue to cross paths and talk more on this issue, perhaps when the new South Africa report comes out. So, all the best for that. And everyone listening in, thank you so very much for joining us. For those of you who will be in Pretoria in a few days, we will continue the conversation on investment case for clean air action. But otherwise, Science on 7th will be back in August, and we will talk a little bit about air quality modeling and forecasting. Until then, stay safe. If you're in a place experiencing heat, please take care of yourself, and I'll see you soon. Thank you very much.
Thank you, and bye.